Good afternoon, everyone, and thank you for attending EDGE's webinar today. Today's webinar is entitled AHCA Level 2 Fingerprints, Clearinghouse, and Photo Requirements. My name is Meredith, and I'll be your moderator. Your presenter today is Ryan Fadden, our Compliance Administrator. Ryan also oversees all aspects of our Florida fingerprinting sites. During this presentation, Ryan will cover the recent changes to the fingerprint collections related to AHCA. He will also demonstrate a walkthrough of EDGE's registration process and some added tools and benefits we will be providing to you. As a reminder, all attendees are in listen-only mode. You have the ability to type questions into the GoToWebinar dashboard. To do this, simply type them in the questions box and press send. We will address all questions at the end of the presentation. And without further ado, I'll go ahead and let Ryan get started.
Good afternoon, everyone. I'm glad you could join us for the webinar. I'm just going to kind of jump right into it and give you the overview. Some of this has been updated from the last webinar we had, and just we'll answer any questions we can for you at the end. If I don't have an answer for a question, we will find it for you and get back to you, but let's just jump right in. So as we all know, House Bill 943 was passed into law in mid-2012. This bill modified existing legislation related to the long-term care background screening requirements. It also granted AHCA and FDLE the authority to establish a clearinghouse and to make any of the rules they needed for its implementation. The intent of that legislation and of the agency is to increase the effectiveness of the screening program and retrain fingerprints for automatic rechecks. So AHCA did in fact establish the Care Provider Background Screening Clearinghouse. For this presentation, I'll just refer to it as the Clearinghouse. In order to participate in the Clearinghouse, there were really three things that have to happen. One is a photo has to be captured by the live scan vendor at the time of collection. Now, the photos are supposed to be up to SAP 40 standards. That's an FBI standard, and it has to do with lighting and resolution and cropping specifications. It's not too important for you other than to know that the live scan vendors who are going to have photos do have to meet certain requirements, and it's not just simply taking a photo with a webcam. The second part of that is that the prints have to be submitted to a new ORI number. For those of you who don't know, the ORI number is simply the identification number that goes into the fingerprint machine and lets the fingerprint machine send those fingerprints to the correct state agency or end up at the correct state agency. So AHCA deactivated their old ORI and they issued a new ORI number. So that's again something that live scan providers should take care of for you, but you just need to be aware that that changed. The third thing is that the applicants can be registered through the AHCA site, but that they must sign a privacy policy. I'll cover the privacy policy in a little bit more detail as we go through the process, and we'll have copies available for you. In fact, right now, if you log into WebScreen under Docs and Tutorials, there's an AHCA section, AHCA documents, and you can pull up that privacy policy right there. Also, our customer service reps and account representatives have copies that they can distribute to you. The Clearinghouse will also allow other Florida agencies to access the screening results. So I know some of you participate in AHCA, and the facility is also regulated by the Department of Elder Affairs. As an example, if you're getting both sets of prints right now, eventually you'll be able to get one set of prints that counts for both agencies. We expect that the agency will roll out the other agencies in the coming months. Obviously, AHCA is going to be the first kind of a flagship agency that utilizes the Clearinghouse. So I'm trying to think. The other thing that the Clearinghouse will do is it'll allow for improved notification, and it'll allow more criminal history information to be displayed, actual results, an actual rap sheet instead of just eligible or not eligible. And it'll also help with the automatic renewal of background screening. Right now, it's unclear exactly how that renewal process will work at the end of 5 years, But it is known that each facility will need to maintain a list of current employees via the AHCA registration site, and that AHCA will automatically resubmit the prints to FDLE and the FBI. The benefit of doing it that way is that if it's under that automatic renewal program, the indication is it would be at a significantly reduced rate, somewhere in the range of about $16 there to renew a screening instead of paying for another set of fingerprints and the whole process over again. But as more detailed information is released on how that renewal process works, we'll let you know. But the change to the clearinghouse is kind of the mechanism that's going to help facilitate that program. Retention. So FDLE will also retain the fingerprints submitted to this new ORI. I put the new ORI up there just so you can see it. Again, your vendor should take care of that and having that programmed in the machine, but there it is. And again, the retention piece of it allows AHCA to do their automatic rescreening program, and probably the most significant for you immediately is that it allows AHCA or FDLE to notify AHCA of subsequent arrests. So in other words, if you have an employee who's participating in the clearinghouse and after they've been printed and in the clearinghouse they're arrested for a disqualifying offense, FDLE would have that pop up and they would notify AHCA, and then AHCA could then notify you as the employer that an arrest for a disqualifying offense had occurred. So what's the bottom line? The bottom line is that on January 1st, AHCA did activate the new ORI, and fingerprints are now being retained by FDLE. So along with that new ORI, the government fees associated with all of the AHCA prints increased by $24. And again, that $24 is the fee for retaining the prints at FDLE. Previously, the government fee was $40.25. After the first, the government fee is $64.25. That's a $24 increase. In addition to that, the collection fees are expected to increase by about $1, some cases less. That's just for the collection site to take on the added work of actually capturing the photo. And again, it's more than just snapping a webcam photo. There's lighting and cropping and resolution requirements to keep that up with the FBI standards. The good news is that we've been monitoring the changes, and we've kind of been positioning our network to continue to provide you with collection services. We continue to add photo-capable sites to our network every day, and each week we expect to roll out more of those. Right now, or previously, before the change, we had about 120 sites in our network, and we plan to have all 120 sites back up and photo-capable through February of 2013. Our customer service is equipped to walk you through the new processes, but while the agency did activate the new ORI, the AHCA registration website has not gone live yet. The agency has indicated to us that it would be at least another few weeks in development. However, when that site goes live, we'll use a web screen to direct you to the AHCA registration page, and there you can register as normal. That's the process I'd like to walk you through today. In the interim, Edge is directing you to all the available collection sites while we wait for AHCA to launch their registration site. So in the interim, if you find that a site is too far away or inconvenient, or you're having trouble getting in, please just call our customer service team and we can address that situation with you specifically. And also know that while there may be a little bit of pain here while this change and transition happens, by 13th or by the end of February, everybody should be back and able to use the collection sites that they're used to, and then have those sites be photo capable. So now I'll move into the demonstration portion. Give us 1 second while we pull up. Okay. So for the purpose of the demonstration, I'm using the production site. The pre-production site mirrors exactly the live site. You'll log into web screen as you normally do and select the appropriate account. Once you've selected the appropriate account, you'll go to Add Request, and you'll begin entering demographics information just like you normally do. Not all of these fields are required, but you can enter as much information as you can. That'll help us later on. It'll populate the blue banner more thoroughly and increase the speed at which you're able to go through the registration process. For the purposes of a demonstration, we'll just use St. Augustine as the zip code. Also, many of you have multiple facilities. You'll need to select the correct facility on those boxes on the lower right-hand side. If you don't have multiple facilities, you can just move to selecting the correct package. For those of you who do not have packages set up, you can always just select Fingerprint Live Scan in the a la carte selection and hit Process Searches. The next pop-up will give you the ability to select different fingerprint types. Most of you will be set up for only AHCA. If you are set up for another agency, you can see there you'll be able to select that. For the purpose of the demonstration, we'll select AHCA. This pop-up is new. It's an acknowledgement box. Previously, well, as part of the registration process, you'll now need to select a live scan collection site from a list of providers through the AHCA registration page. Many different vendors will appear on that listing. In order to keep your billing consistent and consolidated to avoid additional fees and to ensure that you're using an approved live scan partner, just please make sure that you only select providers that appear on this list. Those providers are L1, L1 Identity, L1 Enrollment, Morpho Trust, Cogent, and Cogent Systems. If you select a vendor not contained within our network during this process, you may experience increased cost or some type of registration error. It's also more difficult for us to troubleshoot or track your prints if you're using someone outside the network. Many of the providers not contained within our network will not have an online registration mechanism, and the only way they'll accept payment is on-site with no options for billing. Anyway, once you read through this, you'll check the acknowledgement box, and that'll activate the button. Click I acknowledge the above, and you'll be brought to this screen. This screen should be the same that you're used to in the current process. You can fill out the demographics information just as you normally do. I'm going to skip over it for the demonstration. Now you're on the confirmation page. On this confirmation page, just double check one last time that Social Security is correct, the name. You can make corrections if you need to, and then continue with your searches. This next screen is where you're going to notice the biggest difference in the process. There's going to be two primary changes. The first you'll notice right away is that the new blue banner is expanded. And the second is that instead of being directed to a vendor registration page, you've been directed to the AHCA page. You'll be familiar with this AHCA login screen from accessing AHCA screening results. You'll now need to initiate your screening through the AHCA registration site. You can log in using the same credentials that you used to obtain results. The expanded blue banner now contains all of the information you need to register with both AHCA and with the LiveScan vendor. Under the collection site information section, you can notice that we've reminded you there's a new ORI, and we've displayed the facility-specific AHCA number, as well as provided you with your specific billing account numbers for the vendors available. Under the applicant information section, we've displayed all the applicant demographics information that will be required to complete the registration process. I'll also point out that we've made this point and drop available, meaning you don't no longer have to highlight exactly what you want. You just click and it'll highlight the appropriate selection. That way you don't miss a digit or a character. You don't have to make sure that you have dashes in there correctly. You can just click once and then drag it and drop. You'll also notice there are two additional pieces to the banner, the HHSOIG section and the 1, 2, 3 steps at the bottom. I'll go through those in a little bit more detail as we go through the actual process. So you will log into the AHCA screen using those same credentials. Once you log in, you'll select a tab that says Register Applicant or Begin New Registration. This will appear somewhere up there with those other tabs about Us, Dashboard, Public Records, somewhere in there. Again, because AHCA has not released the final step-by-step, we can't give you the exact flow. However, there are a few main components to the registration that I can run through. The first part is that you will enter the applicant's basic demographics information into the AHCA site. You can complete that portion quickly by simply clicking and dropping the needed information from the blue banner above into the appropriate selection. The second piece that we know AHCA will require is that you confirm you've had the applicant sign a privacy policy. We're going to bring up the privacy policy now so you can take a look at it. This is the one issued by the agency. It's 3 pages. One page is AHCA's, the second page is a national one, and then the third page is their actual acknowledgement form that the applicant will sign. The applicant or employee will need to provide a wet signature on that document, and then you as the employer should keep that in their employee file or their personnel file. The AHCA site is simply going to ask you to check a box that says you did obtain it. So that's the privacy policy portion. Again, that's available in web screen on docs and tutorials. Also, customer service or your account reps have copies in PDF that they can email to you or provide you in another manner. So those are the first 2, demographics, privacy policy. The third one is the HHS OIG exclusions list. The agency is going to ask you to check a box and say that you have checked the exclusions list and that the person that does not appear on the exclusions list. Now, in their site, they're going to provide you with a link. That link will launch you to the HHS OIG site, and that will allow you to search manually for the exclusions list, the name on the exclusions list. We've gone ahead and done that search for you automatically up here at the top of the blue banner. Automatically we run it. You can see this one comes back clear. Now, I would say, the vast majority of these will come back clear. It's very few and far between that there's a hit. If it's clear, you're simply going to check the box on the agency website and go through. If it's a hit for some non-clear result, that box will expand and will allow you a link to the site where you can confirm, or you can call our customer service team and they can help you confirm the hit. You see we put a customer service number right up top of that HHS OIG box. You, of course, can use that at any time, but we anticipate that most people needing help with the HHS OIG confirmation. Another thing I'll point out about that HHS OIG search is that we're recording that it was done in the result, so you have a historical record that, in fact, the HHS OIG exclusions list was checked, and someone's not just checking a box on the AHCA site. Okay. So after these 3 items are done, after you've done the demographics entry, the privacy policy, and the HHS OIG component, then you'll be asked to search for a live scan collection site and register with the vendor. This is where it's imperative that you select a vendor from the EDGE live scan network. Again, those are L1, L1 Identity, Cogent Systems, and MorphoTrust. You can search on the AHCA site by either vendor name, city, or county, however you choose to search. Based on the search criteria, a list of collection sites that match or are near your criteria will populate the screen. From that list, you simply choose the live scan collection site that you would like to use. Again, it's important you choose one of the EDGE network partners so that you can have consistent invoicing and utilize all of our services and tracking capabilities. Once you've selected the site, you'll click on the link and a new window or tab will launch depending upon the browser you're using. Depending upon the vendor that you've chosen, the tab will direct you to a registration page. This is very similar to the registration page you're used to with L1 or with Cogent. Now, by launching through the AHCA site to the vendor registration, you'll be able to skip a lot of these initial steps. Most of the vendor demographics information will pre-fill, and that'll save you time with the data entry. For the most part, the only new information you'll need to put into the vendor page is billing account information. Again, the billing code for each vendor is displayed right there at the top of the blue banner. You'll have that information available to you the whole time, no matter which vendor you end up going with. So once you've completed the registration, a confirmation page will appear on the vendor's website. It's the same registration confirmation that you're used to seeing from L1 or you're used to seeing from Cogent. You'll need to print that registration page, and then you'll need to copy the registration ID and paste that into step 1 at the bottom of the blue banner. Once you've put in the registration ID and you've printed the registration page from the actual vendor, you can check the box and you've completed that portion of the registration. Now that you've completed the vendor registration, we need to go back into the AHCA system and complete registration with AHCA. You'll click the Continue button on the AHCA page, and at this point, AHCA will send you to a page that has a series of checkboxes. The checkboxes will allow you to check what other types of fingerprints you would like these prints to be utilized for. So, as an example, if you also need these prints to work for Board of Pharmacy or for Medicaid enrollment, you'll check a box indicating that you want them considered for that program as well. As more agencies are rolled into the Clearinghouse, you'll have more options available as to what those prints might count for. After this section is complete, AHCA will provide you with a registration confirmation page of their own. When you get to that screen, you know that you've completed the AHCA registration. You can simply check the box under Step 2 of the blue banner, AHCA registration complete, and then you've finished out that step. Under Step 3, the Commit button will activate, and you can now click on that. There's going to be 2 warnings that appear, and those warnings are just to remind you you have completed the whole process. Once you're done with that, you'll continue to the Add Request screen. A green box will appear to give you a reference number. If you need help and you want to check back up on the search, you can use that reference number. Of course, our customer service reps are equipped to help you even without the number. So now that you've completed the fingerprint process, there's 2 items you should be physically equipped with. One is a signed privacy policy, which you're going to file in the personnel file, and 2 is a printed registration page for whichever vendor you chose. You'll also have peace of mind knowing that the vendor registration was completed, the AHCA registration was completed, the HHS OIG exclusions list was actually checked, and you have a record that it was checked, and that all the requirements for being included in the Clearinghouse have been met. I know that there are lots of changes and that the process is much different, but we're working as hard as we can to make the transition seamless and with the least amount of pain as possible. For most of you, you should have similar coverage of collection sites. In some cases, you might have a different collection site, but it'll be at least a similar distance to your facility. In other cases, you may have a collection site that's further away. But again, by the end of February, all the sites you're used to using should be equipped to handle the new process. If you find a specific location or your specific location is not practical or overly burdensome or far away, please contact our customer service department so that we can address that specifically. And we really will look to work and get you a solution that works for you. At this point, I'm going to answer some questions. Meredith is going to quickly run through 3 questions that were most common, or 4 questions that were most common from our previous webinar, and then I'll take new questions live. So go ahead and type those into your browser now.
All right. As Ryan said, I have a few FAQs here from the last webinar and some calls that we've been receiving throughout the week. So I'll go ahead and read the questions, and then I'll read the answers regarding those questions. First question, what are the fees associated with these changes? There is a government-mandated fee of $24 for the retention of the FDLE fingerprints. If a photo is captured, the fee for that will be around $1. And we just want to point out that since August 2010, when this new process started, EDGE has not changed our service fees since then. The next question. I know we need to stay within the EDGE live scan network, but what if the location is extremely far away or the time available for scheduling is too far out? And the answer to that is, until all the current collection sites are photo capable, there may be some areas that will experience some lengthy drives or appointments that are further out than usual. In the event that you want to find other options, please call our customer service department for assistance. They will be getting updates on new photo capable sites every day for the next several weeks until all are completely equipped. Next question. If we switch to a different collection site within the EDGE live scan network, can we then go back to the original site once they are photo capable? Yes. We will keep clients aware of each site as they open, so you can go back to your original site if you prefer. And the final FAQ question is, can you confirm that when we do switch to the new blue banner, that we will automatically receive the HHS OIG search and that web screen will record that? The answer is yes. Once the new blue banner is operating, EDGE will automatically run the HHS OIG search and record it in web screen. Remember, if it comes back with a match or hit, you should then call our customer service team so they can walk you through the confirmation process. This will likely occur less than 2% of the time you run requests. Okay, and now we'll go ahead and I'll read some of the questions that we were receiving throughout the webinar. First question is, scroll up here. Do we or the collection site get the new privacy policy signed? If we do, where do we find this new form?
So you as the employer need to get that privacy policy signed before you register or as you register the applicant. You can get that privacy policy, a copy of it right now on our website in web screen under Docs and Tutorials, or if you email customer service or your account rep. AHCA will eventually have that on their website. They have not posted it yet, but we got that document directly from the agency. So you need to retain it in the employee file.
Okay, next question. When will this new process begin? I did not see any changes yesterday when I was on the site.
So the new process, well, the new process on EDGE's site will go live. We're thinking sometime in February. It's whenever the agency has their registration page go live. They were supposed to have it January 1st along with the rest of the changes. However, that's been pushed back, and best indication is sometime in February. In the meantime, there is the new ORI and the new fees. The new government fees are active, and FDLE is retaining the prints. But as far as registering, that should look pretty similar to what you're used to.
I'm just getting some questions here, so bear with us. Do we need to keep a copy of the registration page in the personnel file?
No. You'll need the registration page to give to your applicant so that they can, when they show up for the fingerprint appointment, the collection site has all the information they need. You don't have to retain that per author or anything else, but you just need to make sure you print it and give it to the applicant before they go for their collection.
Okay, again, bear with us. We're getting a lot of questions, so we're just reading them as we go.
There's a question about what the average turnaround time is. The average turnaround time for these should be about the same. Really, the results coming back still follows the same process. The only difference is the collection is different and the photos are going along with that. The PowerPoint will be available. We'll post it in web screen. You can download it. We'll also have a recording of it available eventually. That's just for your reference to go back to. There's a question, does every level 2 require a photo starting now? All AHCA level 2s are going to need the photo to get into the clearinghouse. The other agencies aren't required yet, but as they begin participating in the clearinghouse, they'll also need fingerprints. The best indication is that in the next couple of months, they'll start to roll out other agencies like Department of Children and Families or the Department of Elder Affairs.
And just for you all, also aware that non-photo fingerprints are also accepted at this time. There are some sites that aren't having the photo capable up yet, so you can go ahead and get fingerprints without photos at this time. That will change though. Again, bear with us. We're just having a lot of questions.
There's a question about the HHS OIG search. That exclusions list is something that healthcare should be doing anyway. AHCA is asking that you check the list and making sure that that's done. It stands for Health and Human Services, Office of the Inspector General. It's an exclusions list having to do with Medicare, Medicaid fraud.
There's a question on there, Ryan. I have background checks to do now. Should I wait until the website is up and running?
No, I would continue to do the screening or as normal. You can wait. I don't think there would be a problem. But screenings that are done without the photo capability or that were done, say if you had some done in December, are still good. It's just from now on they need to start complying with the clearinghouse.
Okay, we were receiving a lot of questions here. I don't want to run over our time, so I'm going to go ahead and I know we're going to get an FAQ out to everybody that was attending last week's webinar as well as this week's webinar, so we'll make sure to go ahead and get that together so that everyone has that right in front of them on hand to review at any time. Obviously, you are more than welcome to contact our customer service department at any time. The phone number and email address is up there on the screen. So thank you, everyone, for attending today. Again, this is a recorded webinar, so I will send the link to attendees. We'll also have the hard copy of the slides available, and we will have an FAQ available as soon as we go through all the questions we received today and from last week's webinar. Thank you, everyone, for your time on this. Have a great rest of the day.